Hey everybody, it's Dr. Daniel, and I just wanted to do a quick update because the American Heart Association has released their latest updated guidance on blood pressure medications. And as is the case with statins, and you've probably heard me rant on those, and I will continue to do so. But as they do with statins, they are moving the goalposts. And what they're doing is they're saying now that you should be 110 over 80, which is a freaking disaster. As we age, our vessels, our arteries, our capillaries, that we get stiffer, which means the blood pressure has to go up for perfusion to occur. I mean, perfusion, adequate blood flow. And that's not just for neuropathy, that's everything. That's our brains, our tissues, everything. So I'm going to, and I apologize for reading, but I don't want to miss any of the possible side effects that are going to result from this. So I wrote it all down in a list, but these are just, and these aren't all of them. It's not an exhaustive list. This is just some of them. So side effects of decreasing the blood pressure below the acceptable point: heart palpitations, fainting, kidney dysfunction. Without enough blood flow, the kidneys can't clean themselves out. We need blood. Uh, Angioedema, swelling, joint pain, chronic cough, because again, the lungs aren't clearing out, low sodium and potassium, dizziness, headaches, brains being affected, dehydration, blood doesn't flow, so it can't carry the blood oxygen nutrients fluid anywhere, muscle cramps, gout, insomnia, constipation, tiredness, fatigue, depression, slow heartbeat, which they call bradycardia, sinus symptoms of asthma, sexual dysfunction. When all of that is completely unnecessary. So why are they doing that? Easy. Money, prescriptions, more prescriptions. Is it possible because people are catching on to the statin scam and coming off of those? If you're watching this, more than likely you're part of that group that's starting to question the things that they are doing for you or to you, and may have already opted out of statins because again, there is no information that shows that statins prevent heart disease or have any effect on heart disease or cardiovascular disease at all, which then begs the question, why are they taking them? And there's a much longer detailed explanation with regards to blood pressure medications, but I think it was 1960 maybe or 1970, the guidance for blood pressure was 100 plus your age. Yeah, that's right. 100 plus your age. And then for some reason that changed and then went down to 120 over 80. And where did that come from? Well, standard BP came from a military study where the military took the blood pressure of 1,000 recruits. Average age, around 20. What did they come up with? Well, their average heart blood pressure, systolic over diastolic, was 120 over 80. But hey, the average age was 20 years old. 100 over 20, 100 plus 20, 120 over 80. And it's folly, it's ridiculous to assume that blood pressures won't increase as we age. Personal example, my father, actually, he had a dozen, actually, when I think about it, he had a dozen different documented heart attacks, probably had more. And he was living under a charm sign because he survived. A lot of them had cardioverted twice, so they had to paddle him twice. So technically, you only have a 10% of coming back. So 10% times two is a one, basically a 1/10 of a percent that he should have been alive, and yet he still was here. So they gave him blood pressure medications. He started getting woozy and wobbly. He almost fell. He was a big man. I'm not, I'm only 6 foot, 6'1", and like about 200. He was a big man. He was 6'3" and 275, 285 when he was healthy. And they said, you need to be 120 over 80, which is ridiculous. Large person need bigger blood pressure. Small people, smaller blood pressure, that's fine. But this whole one size fits all blanket recommendation for everybody, everybody's under 110 over 80, it will cause problems. It's going to lead to falls. And worse, it's going to lead to more neuropathy. And don't get me wrong, I'm happy to serve. That's my whole goal is help people, but it's avoidable. We don't, so please, and this is happening more and more often. This is a survey supposedly of doctors within a large medicine group, medical group, over 1,000 doctors, and it's a managed care organization. And they said 5 years prior, was anybody asking about natural healthcare remedies? They said pretty much almost none. Now, today, 5 years later from that original survey, supposedly up to 80% of the visits. Right. So that the shift is occurring. And again, if you're watching this, you're one of that group that's like asking questions. And again, certainly don't have all the answers. I won't pretend to say that I have all the answers, but I know when things aren't working, and we're seeing that the medical system is absolutely broken. And this is just another sign of a money grab. And I don't want to see people having more problems. I want people falling. I don't want more dementia. I don't want more cognitive. That's the worst way to go. This cognitive decline, you lose your brain, you lose your thought, lose who you are, which is avoidable. And back to statins, that can occur with statins as well. So I would say that be measured in your approach with regards to blood pressure. Maybe don't stop taking them entirely, but to go under 120 is ridiculous. 140 over 90 actually is a healthy number. And when I was, I think in my 20s, that's where the cutoff was. And then all of a sudden it was 120 over 80, and for everybody, not just the young healthy people, for everybody of all ages. And this whole blanket recommendation thing does not make sense. I'm larger than my wife. My blood pressure should be higher. I'm not older, but I'm older than my son. I'm older than my little brother. My blood pressure should be higher than them. And so you're here. So you're already asking questions. You're in the right frame of mind. And that's a unique and select group because so many are still waiting for medicine to provide them with the answers. And this is not against the MDs, because I believe they're well-meaning people. They're just kind of trapped in a system that forces them to medicate. And I would bet there are incentives or punishments even if their patients fall outside of the recommended guidelines. So they're kind of being forced into this chute, and it's hard to be outside the system. I'm independent, so I don't listen to anybody tell me what to do. I don't have to listen to anybody tell me what to do. I probably wouldn't do very well if I had to listen to somebody tell me how I'm supposed to manage patients, because I know what I feel is best, and I'm constantly looking out and trying to see what other ways I can improve things for my patients and my treatment modalities, and how I go about solving problems or helping patients solve problems, because that's really the ultimate goal, is to have the patients help themselves, which is really our goal. But this whole new blood pressure thing is a problem. And if they're trying to medicate you down below 120, even, and say you have a problem, you're going to have, that's garbage. There's no research, legitimate research, that supports lower numbers. It just doesn't even make sense unless you look at it from the viewpoint of, hey, we can sell more medications. And again, this is not on the doctor end. Those doctors are controlled by policymakers or policy administrators, and those are the people that are making the rules. So I hope you found that helpful or interesting, or at the very least got you thinking a little bit more. And again, welcome for discussions. If you are somebody that's suffering with neuropathy, let me know. Dr. Daniel at fixmeneuropathy.com. I'll put it in the link below. Email me. I will get back to you as quickly as possible. I do have a lot of people contacting me on a regular basis, but I'm always going to try and help people to the best of my ability. And that includes you in any way possible. Okay. Thanks for listening, and I will talk to you later. Bye-bye.